My name is Lance Charles. This is my wife, Sarah MacDonald. She's the mother of Brianna MacDonald. Brianna passed away on August 23rd from an overdose. She struggled with mental health, and it dragged her down pretty to a dark path. She was an amazing little girl. She had a laugh like no other child. She was there for you when you needed her. And around the time when I came into Brianna's life, Brianna started to experience issues with her mental health. She started experimenting with drugs as well. Her drug of choice was Molly, but would try anything she could get her hands on. Brianna had over 20 recorded suicide attempts. She tried to overdose on prescription drugs that she would steal. Over time, you could see she was going down a very dark path. We as parents started to discuss what we could do and try and get her help. We looked into treatment centers, mental health centers, doctors and counselors. None of it helped. The treatment centers would tell us that she was too young. The doctors would tell us she had behavioral issues. Others would tell us she's too young to diagnose. Brianna's father and I would beg doctors to keep her in hospitals. The doctors would overlook what we said and release her, sending us home with Narcan kits. This was really starting to get alarming. We spent every other week with Brianna at the hospital, it seemed like. She was prescribed many different medications and prescriptions. Some worked for a bit, others didn't work at all. We noticed things were getting darker. She became a ball of rage. She was up all night, sneaking around and doing her drugs. She started to come and go as she pleased. Sarah and I would often get woken up by the police, bringing her home because she was found extremely intoxicated. Police would also be needed when she would have her violent episodes and threaten to kill herself. An officer actually asked me once, what would I like him to do? I told the officer, she's threatening to harm herself. Please invoke the Mental Health Act and force her into a hospital. The officer told me he couldn't because that's against her will. This is when I discovered the Infants Act. This little girl had more rights to her medical decisions than her own parents. She could tell doctors anything they wanted to hear, and they would release her. Back in February of this year, Brianna was found in the kitchen overdosing. Sarah called 911, and an ambulance came a short time later to take her to Abbotsford General. Sarah got very mad when she was at the hospital. She stood up to the doctors who were just going to pump Brianna's stomach and send her on home. Sarah directly told the doctors, we are tired of this. And Brianna needed help with her mental health. This time they sent her to Children's Hospital in Vancouver. Brianna didn't do well there. She was lashing out at staff, screaming. They really couldn't handle her. They weren't fit to handle her. So they transferred her to a place called Cap Soo. It's at Surrey Memorial. They held her for about 10 days. While there, she did have her good days and she had her bad. Sarah had a meeting with the doctors. They told her Brianna was clear to be released, when realistically she wasn't. She had just finished putting a pencil through her hand. Well, once again, Sarah fought to keep her there, and of course, all they did was send us home with a Narcan kit. This is when we started to see the real dark side of Brianna. We noticed she started using drugs like Molly on a regular basis. We were astounded that she could actually get these drugs. One evening, a car randomly pulled up in front of our house. I went outside after asking my wife who this person was showing up in front of our house. Turns out we didn't have a clue. We went out to look, or I went out to check and make sure and ask what this person's business was in front of our place. These were two 16-year-old children there to sell our daughter, Molly. So we took pictures of license plates and reported it to the police. The Police never did anything. Didn't even report back to us. Now I was really getting worried. It was shortly after Sarah started wondering what else was she up to. So she started following Brianna around. Brianna would actually go to a harm reduction site, and she would acquire these Ziploc bags full of needles, cooking kits, and pamphlets on how to cook the drugs and safely use them. We were astounded the fact that these were available to a child. How can a 12-year-old at that time acquire these? She can't buy marijuana at a dispensary. She can't buy booze at a liquor store. But she's able to pick up these kits to use drugs from a harm reduction site, a site that is meant for people that are not children. It didn't make any sense. Now we have reached the darkest times just before she passed. Around the end of July 2024, Brianna became so violent towards her mom and I. And this was a direct result of not just the drugs, but her mental health had gone so far down a deep path. Sarah was destroyed seeing her daughter do this. We talked about it every night, trying to figure out what to do. Days later, Brianna became so violent with her mom and I. She got into a fight with her mom and actually caused some serious damage. Her mother ended up in hospital with a severe concussion and some serious brain trauma. I ended up with a black eye and a cracked orbital socket. Now her mental health was really in a dark spot because now we didn't feel safe with having her at our house when we have other children. So the police removed her from our house and advised that it was not safe for her to be around her other children because now she had become so violent. So they ended up taking her to a place called Cyrus House. And Cyrus House tried to hold her and keep her there. She stayed one night. The next night she didn't return. So Cyrus Center, when she didn't return, put out a missing persons report. This is when we found out she now wanted to be at a homeless camp. The police found her there. They didn't directly tell us that she was at a homeless camp. We found that out days later by ourselves. All they said to us was, she is safe, and she's with another adult who's nobody to us. We didn't know her, didn't even know her name. Since when is it okay for a 13-year-old to be at a homeless camp? Why didn't the police bring her back to Cyrus House? Why was she just left there with another adult that doesn't associate with us? We did keep in contact with Brianna every day. We brought her food, we bought her clothes, but she didn't want to return home. We tried to inflict rules, try to give her more stability and tell her that if she comes home, she's got to follow these. And she goes, why? I can do whatever I want out here. It didn't make any sense. You know, if she needed clothes, she needed anything, she could always reach out to us, and we were there for her. Now we come up to August 22nd, 2024, and August 23rd, 2024. I went to work on August 22nd thinking this wasn't going to be a change in my life. I was at work, and I worked night shifts at C-SPAN International. And my wife, who never calls me at 3 in the morning, I received the phone call, the one that a parent dreads. She started the conversation off with, I love you very much. This is when she proceeded to tell me that her daughter had passed. This is every parent's nightmare. This is when we realized the system we have in place has failed her, and massively. The people she could go to for help failed her. My question, and always will be, is why are harm reduction places considered safe? Why our children aren't allowed, or not, I shouldn't say allowed, why is there no programs really in place for our children and their mental health? These drug addictions would have never become what they were if she could honestly get the mental help. She used to tell us she would have demons and voices in her head, and the only way she could drown them out was through the drug use. I don't know about you guys here, but when you stand back and think about that, that is very alarming. That a child is using drugs to drown out voices in her head. The mental health problems were there, but anybody we reached out to weren't. They would send us home with Narcan kits. They would tell us that we can't force her into anything against her will. On September 19th, Brianna's friend, Chayton, very, very lovely little boy. They were best friends. They started experimenting with drugs because they both struggled with mental health. He had a very hard time dealing with the fact that Brianna was gone, to the point where he made a suicide attempt shortly before Brianna's funeral. And days later, after her funeral, succeeded. He is no longer with us. These are two 13-year-olds, two of them, that have passed. Now, not only because of drugs, but struggling with mental health. We need things to change because our children are dying, and we can't afford to lose any more children. I thank you for bringing us here to speak, and I hope Brianna's story, and as well as Chayton's story, can bring awareness to the struggles that our children are having, and to bring awareness to the parents that are struggling with children that are struggling. It hurts every day thinking about this situation, because I think if Brianna had access to the proper mental help, she'd still be here today and be able to tell you this herself. Instead, we have to speak on her behalf because she's no longer with us. It breaks my heart having to speak about a child that's no longer here. We do need change, and it needs to be now. Our children are dying, and no other parents should be going through this pain. And I hope today we can bring some answers and enlightenment to this subject. I thank you.
Thank you, Mr. Charles.
I want to thank you guys for your strength. And I don't know if I would have had the same strength that you have. And so I thank you for that. If you could send one message to Justin Trudeau about the failed drug policies, what would it be?
How can you put safe and drugs in the same sentence? doesn't make any sense. Those two contradict each other deeply. And the policy, you should just look at those two words and it should tell you and give you an answer right there. Safe and drugs don't mix.
The system failed, Brianna. We just needed one adult to stand up in the room to fight for you. You begged doctors and you begged those people that should have been there to do no harm and to help your daughter. What was the message that you got?
That the help wasn't there. The doctors kept sending us away. And it kind of sent a message that really it didn't matter at all. That she didn't matter. And her mental health didn't matter.
I think I read somewhere that you were essentially told if she wanted to kill herself, that's her choice. Is that true?
Yes.
Very true.
Do you believe that Brianna would be alive today if she got the help that she needed, the mental health help?
I believe not only would she be here today, but she'd be able to speak out on her own situation and what she's gone through. I believe if the help was there and available, her beautiful smile would still be here.
And just to be clear, Brianna had just turned 13.
Yeah, just in July 15th.
So she was just a month into her 13th year. July 15th, did you say? It's the same day as my son's birthday. And I should note that she passed away on my daughter's birthday. What does Brianna's story say about the state of mental health care in Canada?
Pretty much that it's broken. The system that is designed to be there to help her and guide her through life, especially when it comes to struggling with mental health, it just isn't there. And whenever we did approach doctors about change and how to get her help, she was either too young for programs or there was no programs at all.
They allowed a 13-year-old to write their own safety release plans, is that correct?
Correct.
She wrote on that plan that she was a very manipulative little girl. And my question is, why was a child allowed to write her own safety release plan when doctors are supposed to be doing that? Because they're the adults. They're the ones deciding on how her safety is supposed to be, not a child that's unwell.
And you were powerless.
Absolutely.
From the time she ended up on the streets to her death, how long was that?
Almost 4 weeks.
It was, sorry?
Almost 4 weeks.
And her drugs of choice were Molly and fentanyl?
Molly, fentanyl, anything she could really get her hands on. Molly was her
Molly was her DOC.
that was her drug of choice, yes.
Are safe injection, safe consumption sites working?
No,
Absolutely not.
no, they don't discriminate against age, and they keep providing kits to these children. And it's very easy access.
It's everywhere. You can't go anywhere without seeing it now. It used to be taboo to see a joint being smoked on the street. Now you can walk by people smoking crack. It's disgusting.
We sat at an A&W once having lunch. This was 12 o'clock in the afternoon, broad daylight. And I had to tell my stepson to literally not look out the window because there was 6 people sitting there cooking their heroin down to be able to inject it right out the window where we're having lunch. That's not acceptable. That's not what I call safe.
Have our communities become less safe in recent years?
Absolutely, and I believe they're getting even more unsafe as the days pass.
Thank you, Mr. Doherty. Thank you, Mr. Charles. Next, Madame Brière for 6 minutes, s'il vous plaît.
Thank you, Mr. Chair. Mrs. MacDonald, Mr. Charles, you have my deepest sympathy, and I share your pain. I salute your courage in sharing this heartbreaking story. What do you think should be done to involve parents in the prevention work in order to protect our Canadian youth?
Our children, we need to be able to stand up for them and advocate for them, not for them to advocate for themselves when they're too young. We are supposed to be their legal guardians. We're supposed to take care of them. We need to do so. We need that authority back.
And as it sits right now, we're just guardians of the government's children. They're not even ours.
Yeah, but did you know where to go to seek for help or to seek for services?
Absolutely, and I exercised every option that I had. I went to hospitals, I went to mental health places, we went everywhere, and we were basically told we have exercised all our options, and we are sorry, and we condole you, and we're happy for your best efforts. Thank you.
And the only gift they gave us really was an Narcan kit, which that's pretty alarming as a parent. Receiving a Narcan kit instead of, hey, here's a doctor's number, maybe these people can help. Social workers didn't have a clue, because and their answer to us was, our resources are so limited. And especially because of her age, there wasn't much they could do.
Yeah. So do you think that the services are more for adult, more targeted for adult than for youth?
I believe when the harm reduction stuff was brought in, that, there was an aspect that children weren't really thought of at that point, because really recreational drugs and stuff like that was more of an adult thing. But now, I hate to say it, it's reaching our children at a very alarming rate, and the children are suffering. And I don't think it's because they choose to do the drugs. I think it's because their mental health is really in the dumps, and it needs to be changed. Mental health needs to be changed, and so do these policies.
Thank you.
As the local MP for our community of Abbotsford, thank you for being here. You mentioned the Cyrus Center. I live just off George Ferguson. This is around the corner of my house. Thank you for sharing your story. If you could send one message to the Minister of Mental Health and Addictions about some of the failed drug policies we have in Canada, what would that be?
That we need more help. The healthcare providers need way more help. There just isn't enough. I get it, there's an opioid crisis going on, and there's a lot of people dying from drugs. But the mental health aspect is a big leading factor. And we can't overlook mental health. Drug use and mental health issues go hand in hand. And in order for it to stop, we need more funding.
As you know, the government of British Columbia and Canada signed a special agreement for decriminalization of hard drugs in British Columbia. Is it your experience that it became easier for children to get drugs since decrim began? And how did Brianna generally get her drugs?
I believe it did, actually. The decriminalization of drug use and possession of drugs actually increased the drugs coming to British Columbia. It lowered the prices. It made it easier to acquire because, hey, your mental health medication, a lot is experimental and you have to pay out of pocket. And it's not always covered. But the drugs can replace that. And people were replacing the mental health pills and prescriptions with the hard drugs. And as per Brianna getting her drugs, you know, she used a lot of it through 16 and 15-year-old kids. And these 16 and 15-year-old kids they actually got really ballsy and showed up at our house one evening. And I actually had to escort them out of my neighborhood.
I'm just going to ask one more brief question and before I turn it over to MP Goodridge. But as a parent in the public school system in Abbotsford as well, what role does the Abbotsford School District have to play in keeping our kids safe?
I feel there should be more police liaisons. I feel they should be checking the children before they even come to school. If found with drugs on them, they should be punished and realize that it is wrong. And they shouldn't be having access to these drugs. Nobody should.